Welcome everyone to Optimizing Patient Payment Plans. My name is Clark Atwood. I'm with CoreTec Brokers. I'm joined here by Eric Wixom, the CEO and co-founder of Wixcorp, and appreciate your attendance here today. And Eric, go ahead and let's just get right into it.
Yeah, absolutely. So as Clark mentioned, Eric Wixom, co-founder and CEO of Wixcorp, excited to be with all of you today. Just as a quick introduction into CoreTec and Wixcorp, Clark, maybe if you want to give a
Sure.
quick update on CoreTec, and then I'll do mine.
Sure. So we are technology brokers. We are independent, and we have a deep portfolio of technology service providers, Wixcorp being one of those. I don't need to read the slide there for you, but there are at least 12 reasons why you'd want to use a technology broker. One of the biggest reasons is choice, and you have an advocate on your side. You definitely would want to use a broker in many cases rather than just working directly with the service provider directly. In addition, we bring a lot of value. We're here during before the sale, during the implementation, and post-sale. So we have a lot of value that we bring to that. If you have any questions about that, certainly can answer all those.
Excellent. And we're so excited to continue our partnership with CoreTec and with Clark and your team. And just as a quick intro to Wixcorp, we're a patient engagement and experience company. Our goal is to live at that intersection between healthcare revenue cycle and the patient experience, try to make all those salient touch points across the financial journey just intuitive and engaging, and helping the patient really manage a lot of that work. But the goal today, we're going to talk a little bit about that patient experience, specifically post-care payment plan management, and some best practices and tips that we can share there. But to really jump into that, I find it helpful anyway to compare healthcare to other industries, and kind of look at where's the customer experience today and what are they expecting from us, and then how that translates into some of those tips and best practices we're going to share. So just jumping right into it, let's look at patient financial experience. I had a really interesting experience the other day. This was about a month ago. I had dropped my daughter off at ballet, and I had about an hour and a half to kill before I need to pick her up again. I knew my car needed an oil change, so I picked up my phone and I just typed in oil change into the maps. It popped up with, here's different locations near you that you can get an oil change. What time did they close? Because it was in the evening. And then on any of them, I could click on the website and it would show scheduling options, or if you could just drive in or however, right? So I had really good digital options there, especially around those scheduling. I decided I just wanted to drive in. They did just kind of that immediate, you can pull up and they'll take care of you, right? So I pulled up and the attendant came forward, said, what do you need? Said, I need an oil change. He said, great, we got good, better, best, right? And here's the prices for each of those. Said, that sounds fantastic. I appreciate that pricing. I have some rock chips as well, though. Can we get those fixed while I'm here? Do you have a guy here that can do that? And he said, you bet. What insurance do you have? And I said, oh, I use this insurance. And he said, oh, not a problem. They cover it fully. So happy to knock that out for you. That was great. So I went into their lobby, hung out in the waiting area there. And as they always do, they come in right with your cabin filter, and they're like, hey, you got your cabin filters kind of bad. It's going to cost you this much money to be able to take care of it. Do you want to or not? And talk to them about that for a minute. And then they come back later and say, okay, it's this much money for today's visit. You can either pay it in full, or we offer financing, or you can do 3 or 4 other options for payment there, which was really convenient, and took care of that. And they also said, hey, by the way, we noticed the tire treads getting down a little bit low, that you might want to consider that later this summer, and based on mileage you're due for these types of maintenance things, feel free to call us and schedule that at any time. Thought, great, really good experience. The whole thing took maybe 45 minutes. Went back, got my daughter, life was good. Now, about a week after that, my son was sick and I needed to get him some care. And so it was a Sunday morning, and we knew right out of the gate that we needed to schedule an appointment. They didn't have any walk-in available, and we knew that we had to go to a specific place because that's who takes our insurance. We called them at 7 a.m. They said, great, happy to see you. We'll be ready for you at 7 p.m. It's our next open time. Okay, fine. We'll kick it for 12 hours, and then I'll bring my son in. I pulled up on my phone the pediatric office. I clicked on the address and started driving. As I'm getting about halfway there, I realized the address is wrong. Like it's completely wrong. I'm heading into the wrong place. I have to call my wife to figure it out. It was way off. Once I get in, there was no discussion of payment, right? The only thing around payment was a sign up front that said, if you don't show up on time, we'll charge you $35. That was the only payment information whatsoever. Then I go up and they say, can we get a copy of your insurance card? Now, I have 6 kids. We go to the pediatrician frequently in our household. And my wife warned me in advance and sent me with the card. She said, they're going to photocopy it. I don't know what they do with it after that, but they're going to ask for it and photocopy it. So I bring in the card, they photocopy it. So at least they're making sure there is some insurance there, right? I go in, we're seeing my son's being seen. They need to run some extra tests. They don't talk about pricing of any kind or costs, just, hey, you need to have this and this done. So we take care of all of that. As we're leaving, no conversation of payment whatsoever. I didn't know how much I would be billed. I didn't know what it would cost for any of it. I just knew I had to go. And finally, no conversation around maintenance, right? So my son is going to have his birthday here shortly, which I know means well-child visits, vaccinations, all the things that are going to happen, right? Pediatrician office didn't talk to us about any of that. They just said, here's your prescription and sent us out the door. Having these two experiences about a week apart made me step back and say, holy crap, my car got better care and experience than my kid did. And I love my kid a whole lot more than my car. But unfortunately in healthcare, this is kind of this generic experience we're having. Now, Clark, I know you're probably itching to comment here because I just threw a ton of stuff out.
Yeah. I got to tell you, I went through a veterinarian experience 2 weeks ago with my dog, and I had a much better experience at the vet than you've had with your child, because they're more prepared for most of these things than the doctor's office is. I've had similar experiences with healthcare, but yeah, it was pretty well more like your car experience at the veterinarian for my dog than it was your child. So that kind of sad comment.
It's rough, right? It's really rough. And we within the industry, we can rattle off the million reasons why, right? We can tell you, here's all the complexity, here's why healthcare is different, here's all the issues of why. The net result, nobody cares, right? Our patients don't care at all that we have problems of being able to provide it. They just expect us to have it.
It's a bar, right? You have to meet the new bar. And if your car's getting a better bar than your child, that's a problem. And whose problem is it? Is it your problem? I've always joked that my wife has a part-time job. It's called healthcare reimbursement from insurance companies, right? That's her part-time job and has been for 20 years.
Yeah, it's rough. And I love this quote from Brendan. He's a analyst with Forrester. Every time an individual is exposed to an improved digital experience, their expectation for all experiences are reset to the new level, right? And we know this is true, right? When Netflix comes out with a cool new feature, almost immediately Disney Plus and Amazon come out with the same thing, right? And vice versa. Whenever a new experience, an improved experience happens, we as consumers, that's our new expectation. Well, if they can do it, everywhere should have it.
Well, I've got a question for you, because we're seeing more and more, let's say, surgical centers, urgent cares, surgical centers, they're all popping up. We have healthcare customers that have clinics and hospitals, and they're seeing this as competition. But what's happening is they're coming in with a system. And so if you want surgery, you can go to a surgical center. Why would it go to a hospital? Because it's so much rougher of an experience than just going to the surgical center. So I think that healthcare is under attack, and those that adapt win, and those that don't die, right? Is that what you're seeing?
Oh, 100%. Absolutely. Healthcare is in the middle of being disrupted. And I've done lots of other presentations around the disruption of healthcare, what that's looking like, what it's going to look like, how it's impacting us. But the net result, consumers today are shopping by experience, right? From a quality and cost perspective, I can get really good quality care at about the same price at a ton of different institutions around me. I choose the one that has the best experience, and your customers do as well.
I used to laugh at the billboards that promoted the wait times in emergency rooms,
Mhm.
right? I used to laugh at those, but it's they're advertising your experience is going to be better at this emergency room, and I get that. This goes back a couple of years, but my son ended up with a gastrointestinal issue, ended up in a meeting, doubling over, had to bring an ambulance in. We're out of town. The ambulance comes, and the first thing, what does the ambulance ask me? What's the first thing they ask me? Where do you want us to take him? Which
Yeah.
emergency room? I'm not from that town. I don't have a tool in my hand to say what hospital is going to cover insurance wise my stay if he's admitted. Most will cover insurance room visits, but after the insurance room, if you're getting him into the hospital, you've got to have coverage. And I didn't have a tool to do that. So we're here in an emergency. The ambulance is waiting, and I'm on the phone with my wife trying to figure out where to send son, my adult son, to an emergency room. It was the most frustrating thing in the world. And of course, what you normally do in that situation is you panic. I don't care. Get him to the hospital,
Right.
right?
Which is
And then
corporate.
the ramifications of that could be massive financially for me for that
Absolutely.
one decision. We just shouldn't be putting patients in that kind of situation.
100% agree, right? So as patients think through that, right, you're in the driver's seat. You have some say and control in it. And so I think it's important to think about then, what are some of the market forces that are driving this so that we as providers know how to manage it, right? We need to understand how we got here to really know what we've got to do to change. And so I want to talk a little bit about what are some of those market forces. There's hundreds of them, right? There's tons of market forces out there impacting us, but I want to highlight three critical. And Clark, you bring up the first one, which is insurance, right? Insurance, because we're a third party payer industry, insurance drives a lot of what we do. From a patient experience perspective, a lot more of that money is coming directly out of their pocket than before in a couple of fashions. The first is high deductible health plans, right, which is what we're showing on this chart. About 20 years ago, employers and insurers hit that saturation point of we're not going to continue to cover the rising costs of care. And so the main mechanism that they're offshoring that is through high deductible health plans, which means the patient now has to pay more and more out of pocket to cover that rising cost of care. Premiums likewise have gone up dramatically, right? So in the last 20 years, premiums went from 6 grand to 24 grand, right? It's gone up dramatically. Again, more and more money coming out of the patient pocket directly, which is way harder for us to be able to manage, right? For us as healthcare providers, being able to get money from the patient is dramatically more difficult than it is to get it from an insurer. And of course, there's idiosyncrasies there that we could dig into, but the insurance side has been heavily automated. The patient side is still extremely manual. The net result is that in that same 20-year span, healthcare debt has grown by 620 billion. Now, this is a couple years old. We're closer to like 650, 675 now in unpaid patient debt that's sitting out there. Again, once it hits the patient responsibility, we're struggling to be able to get them to engage and pay that bill. So, force number one. Um, Second economic issue here is just economics in general, right? So I love this graph. This is showing the cost of good compared to inflation. Um, and so if you can't read the detail there very well, blue going down means the cost has lowered relative to the buying power of the dollar. Meaning, think about televisions, right? That's the very bottom one on there. 20 years ago, if you wanted to buy a big screen TV, you're going to a specialty shop and you're paying thousands of dollars for it. Today, I can get a big screen TV from Walmart for a couple $100. The cost has gone down dramatically, which is awesome. The very top line there is healthcare, right? Hospital services in particular. And that hasn't even budged. Even COVID had a very minor impact on it. It just has continued to grow and grow and grow. When we look at the broader economy, right, we see a lot of news headlines out there right now, right? Economic impact is slowing. Most prognosticators are saying we're heading into a recession or at least a good slowdown. Layoffs last year, 125,000. We've already broken 150,000 in the first quarter this year. Inflation is growing, and we just went through a bank run, right? I bring all this up, and you can feel, I can feel my anxiety level rising just talking about this. your customer's anxiety level is rising, right? They're worried about continuing to have a job. They're worrying about the rising costs. They're worrying about financial crashes, right? We're getting flashbacks to the housing bust, and we're like, holy cow, that was really horrible. I'm going to start being way more careful. Clark, I'm sure you're seeing this a ton across every industry.
We are. We're seeing a lot of people just close their wallets up and say, make do with what we have the best we can, and let's see how we can ride this out. And it's not a political discussion. These are factual things of inflation and concerns that people have, and they're looking at their customers, and the amount of spending is reducing, right, in the home as well as in the business.
Absolutely. The net result of a lot of these, a lot of patients becoming more concerned. COVID obviously retracted a ton. We're continuing that. The net result: 1 in 5 rural hospitals are in danger of closing today. I saw another article that said over the last 10 years, I think it was 120 rural hospitals have either closed down or changed operations. And when we look at urban settings, bankruptcies are soaring, right? It's just struggling in a lot of ways there. The third market force I wanted to look at then is consumerism. And here's kind of some bright spots, but still worth talking about, and some concerns for us as providers. When we look at healthcare delivery options have grown dramatically over the last few years, right? We've had more and more family practice centers opening up, more urgent care centers opening up. We've added things like retail providers and telehealth, which weren't there a few years ago. At the end of the day, and Clark, you mentioned surgery centers are growing a ton more, right? At the end of the day, we have 42% more provider options than we did 20 years ago, right? As consumers, that's fantastic in that we have options. Why we have the ability to choose where do we want to seek that care. As providers, it means we need to be way more in tune to our patients so that we can attract and retain, right? The other piece that's going to be driving this consumer shift, though, is again that out-of-pocket cost, right? So after insurance costs, because of the propensity of high deductible health plans, or the prominence of high deductible health plans, more and more is coming directly out of the patient pocket, right? They're having to get that card out and pay higher copays, higher balance after insurance items that make them be way more cognizant around, where am I seeking that care?
Yeah, I've been on the road the last couple of days, and my wife had an issue and talked about it, and we have a telehealth option. So she got on an appointment on telehealth with a doctor rather than go to our primary care physician. Went through telehealth, diagnosis was made, prescription was done, and you know what? Why would I want to get in a call? Why would I want to call for an appointment? Ask them if they can call me back if they get a cancellation, because they're full today and tomorrow. So I'm waiting for a cancellation when I can just get on telehealth, get a competent doctor within the next 2 hours, get on a call, have them diagnose it, prescribe it, and then have the prescription done. I mean, all done in 4 or 5 hours, and never left the house. And so these options are not going away. They're going to just simply increase. It was not a COVID issue. This is the new experience. In fact, if you haven't seen the Mark Rober video on YouTube regarding drone delivery, and it's specifically around healthcare, and the new drones that they'll be flying this year, literally you can do a telehealth call, and by the time you finish your telehealth call, your meds will be on your back porch. This technology, it's not tomorrow, it's today. So that's the other thing.
I love that. What a great example, right? There has been, I think it was, the last I looked, it was like $85 billion have been invested in healthcare startup in the last 5 years, right? We are throwing gobs of money at this, knowing that we're at that inflection point as an industry. We are going to be disrupted. Technology is going to change the way that we interact and receive care. We're not sure what's going to be the one that grabs it, right? Drone delivery is going to be a part, and I doubt it'll be one, right? I don't think there's going to be an Amazon that takes over all of healthcare. I think there's going to be incremental shift here of lots of little things, but the net result being 10 years from now, healthcare delivery is going to look completely different than it does today. From the consumerism perspective, right, patients are struggling to pay that. We're having a hard time managing it. And that result is 100 million adults have healthcare debt today in the US, right? That's 1 in 3 almost. That is a huge amount of debt just sitting out there that we're struggling to figure out how to collect, and patients are struggling to figure out how to pay it. With the rising costs of care, with all these things in place, right? One of the things, and here's where we get to the kind of the core of the conversation here, one of the main mechanisms we've seen patients respond to in helping alleviate that debt has been payment plans. And being able to, you know what, I can't pay 10 grand today. I just can't. I don't have that kind of money, but I'm happy to pay $100 a month. I know it's going to take a while, but I can do that. And from a healthcare provider perspective, that's better than a sharp stick in the eye, right? Like, I'll take the money. That's fantastic. I know it's going to sit here for a while, but at least I've got something coming in to help manage that care that I delivered. So we want to talk about 5 tips or best practices that you can take right now today and start looking at how do you manage payment plans, how do you manage patient payments, and what's your consumer looking for, what are their preferences, so that we can help increase that propensity to pay. So tip number 1, patients are on their phones, right? They are no longer looking at their mailbox. And if they do, they come in, they see the logo on it, they know what it is, they put it on a stack, and it sits there for a couple of months until they have a weekend that they're finally like, okay, I've got 10 of these things. I need to actually open them and see what's going on. Patients are not engaging via paper anymore, and they're not answering their phones if you call them. They just don't, right? Every study shows they want to engage via digital channels, the vast majority that do. And the ones who don't, you already have systems in place for. You're already managing those, right? The ones who are okay with paper, they're already paying you. Don't worry about those. They'll continue to manage themselves. I mean, still allow it, right? Don't just completely go digital and stop doing any voice or any paper or other mechanisms. However, acknowledge the vast majority of your patients want to engage with you digitally, and they want to do it through their phone, which means text messages predominantly will at least get their attention for an awareness perspective. Now, getting them to take action on it, that's a whole nother conversation we could do a whole nother webinar on. But at least from an awareness perspective, sending them a text, they read it and they know that it's there. Sending them an email, they at least see that something's there, and it's way easier to engage with them on. Clark, anything to add there of?
Well, I think that the texting is key. There's a lot of things going on with email right now, specifically with spam filtering and junk mail, where unbeknownst to the companies, you may try and send an email to a consumer, and their service provider, under the guise of being the good guys of protecting their users, are flagging emails that they think are spam or junk. And if you're trying to collect money, that's something that is being highly problematic now. So using the right technology to reach that end user, the technology they want, and the technology you can deliver on is what's key, right? It's kind of good, better, best, right? That's what you were saying before. And email is still good in most cases, but there's starting to be some problems there. Texting, although there are some things going on with texting and campaign, what's called 10 DLC and campaign registration, texting, navigating the technical waters is still the best way to reach it, because these numbers are key. Emails get buried. We all look at your email on your desk. I mean, how much email can you handle, really? But your phone, you clear out those text messages, you read it, right? So getting there is key. Absolutely.
Agreed, 100%. Thank you. All right, tip number 2. When we look at how patients want to engage, they want to self-service, right? They want to be able to manage it on their own. They want to be put in the driver's seat. They don't want a digital experience that's a hard-coded wizard that they just have to click, click, click through. They're either going to A, stop halfway through, or B, be frustrated because it doesn't meet their specific needs. Patients want to be able to have self-service tools that are intuitive enough and have options that allow them to navigate and manage it. When we look at those self-service tools, again, that means digital, right? That means having a really good patient portal, having a really good payment portal, having a really good digital ecosystem right, that allows your patient to go in and safely and securely manage their financial needs with you as an institution. I like to look at this from a banking perspective, right? It used to be if you wanted to do anything with your bank, you had to go talk to the person in person, right? You had to go talk to the teller and you had to figure it out. Today, you just go online. Right. I mean, it's rare that you need to physically go into the bank anymore. You can do the majority of it directly from your phone. Um, that's what patients experience, right? And that's what they're doing right now with banks. They feel like it should be the same with you and every other retailer. The kicker is if we don't do a very good job of it, 70% of consumers will change their healthcare provider for a better patient experience, a better payment experience, right? If it's hard and frustrating to pay you, doesn't matter if you've been their doctor for 20 years, they're going to go somewhere else.
So I've got to tell you about this one because I was hospitalized for COVID in February 2021, and it was what I would call a prestigious hospital. Let's just say more people know the name of this group than don't know the name of this group. And when I was there, I was on oxygen for over a month at home and trying to work through this particular issue. And the answer we got from them is, here is your payment plan. It was like 4 equal payments, very, very large payment plan. There was no negotiation. There was no options, no anything. They're more than willing to do a payment plan, but you have to call them back and ask for one. How would I know, having never been at this hospital, having no association with them whatsoever, know that I, as the consumer, have an action item that I need to take to benefit them? It doesn't make sense. So the digital payment options specifically, and I would say those, just the whole interaction, the patient experience is, if I, as the consumer, don't have all the answers, you've done it wrong, right? You need to, we used to call it Fisher Price it, right? They had two women that worked for me at one time, and they both had small children. They both bought 2 dollhouses. And one bought a Fisher Price dollhouse, and the other one bought another dollhouse. Well, the Fisher Price dollhouse, this was a Christmas gift. Christmas Eve, they're setting it up, and they were done in 30 minutes because it's slot A, tab B, boom, boom. The other person, 8 hours to build this dollhouse. So what are we trying to build? Are we building the Fisher Price options for patients, or are we still going for the complex dollhouse when we think about these electronic tools? We can't. Absolutely. They will leave.
Every time, right? Every time, 100%. All right, tip number 3, right? Limit one-to-one communication. Now, again, you're probably saying, what does it have to do with payment plans, right? If your billing team is having to manage one-on-one communication, meaning Clark has to call you and has to say, I need to set up a payment plan. What are my options? You're tying up that billing person 100% of their time with just Clark to be able to manage that interaction. When really, if we had done a better job on step 2, right? If we had better self-service tools that allowed Clark to go in and manage it, now your team is freed up to be able to manage a whole lot more work, right? So limiting I have to be on the call with you right now, and doing more, I'm on text message duty today, right? So I'm texting patients back and forth, and I'm reading the messages coming in, I'm replying back. I can manage 3 or 4 different conversations at the same time, because I can text this patient, and then while I'm waiting for their response, I can text this patient, and so on, right? When we look at payment plan management, one of the critical pieces that your patients want is that self-servicing, right? But for your teams to be able to manage it, if we can pull your team from frontline support and where they're doing one-on-one communications, and if we can move them to an escalated support where they're only fielding the problems and the questions and concerns, right? If we got step 2 right, step 3 means we can move your team to now a one-to-many interaction where they can take care of multiple patients at the same time, which means your patients are going to get faster service and they're going to have a better experience because that's their preferred method.
It's the 80-20 rule. And if you can get 80% of those patients self-serviced effectively, then your team can spend the time they need on the 20% that are the more complex issues, that need more hand holding. Maybe it's older people, maybe whatever it is, but it's that 80-20 rule. It doesn't mean you're going to eliminate your call center or,
Right.
those agents. It means that your call center agents can now be specialists, and you don't need to have as many generalists. You need to be able to have people who can take care of the more complex things.
Right. And the crazy thing is, it's the patient's preference and it's the less expensive option for us, right? We spend less money, we optimize our teams, costing us less while still making the patient happier, right? It's like the golden ticket here, right? Of we found this secret sauce of putting the patient in control to do the work your team used to do, and they like it better. It's fantastic.
Well, just real quick on my hospital stay issue and the payments, as we're trying to work through the payment issues, they sent us to collections, and then we had to work through, and then they had to back it out, and then we had to redo the payment plan, and all that was just time. It was wasted time on my part as a patient and wasted time on the part of them to be able to handle that. That could have been easily done if it would have said, here's a recommended payment plan. If it doesn't meet your needs, click here. Because you can always present as a hospital, you can always say, here's what we recommend you pay, because that's what I as a hospital want. You don't take that away from the hospital, but if they need something else, then you put it in, and it's something that you build the parameters for. Here are other payment plan options that are beneficial to the hospital, but give them something they will pay. If you give them something that they can afford and they will pay, they'll pay it.
Absolutely. Which leads into our fourth tip really nicely, right? We want to automate these processes. So much of healthcare today is extremely manual. It's funny to me. You see in the cartoons and stuff where you have this big computer and you put in put in your money, and then a meal pops out, and in the background there's a person stuck in there trying to do the whole thing to then push it out the slot, right? That happens so much in healthcare where patients think, okay, I'm setting up a payment plan, and my expectation, because this is what happens on all the other industries, is it just happens and it just goes and does. When in the background, a lot of times it's still the billing team going in and every day looking at, okay, who had scheduled a payment for today, and then going and running that payment. Worse yet, I've seen a number of different payment portals where the patient sets it up on a plan, and really all that's doing is triggering the health system to not send it to collections. But the patient still had to manually go in every month and authorize the payment and push it through, right? Those plans failed constantly, and it just didn't happen. When we look at our payment plan processes, we've got to automate it. We have to make sure that it just runs and it works the way it's supposed to. What we've seen, and these are just some metrics from some of our client sites, when we go in and we automate these things and we put the patient in the driver's seat, they're seeing an 85% reduction in the amount of work their billing team has to do because we've automated it, right? It makes it so much easier, and that payment then auto posts into the EMR. Again, the billing team doesn't have to manually go and put that payment into the financial system so then your systems update correctly. If we can automate those processes, it cleans up so much of that work. We've also found that by automating that, and to Clark's point, putting those options online, 97% of the plans are patient generated and patient managed.
I don't want to get us off the rails here, but I do know you have the capability through your partnership with another company for giving pricing up front and allowing payment up front, right? And even offering a discount to pay up front.
Absolutely.
So you have so many options to get more money faster for the hospital and healthcare companies that I'm just amazed. It's amazing.
Well, and I think the key word there is options, right? And we'll talk about this in a second, but patients love options. If you tell patients, here's your only option, you've got your 4-month plan and that's it, they're going to balk and they're going to fight and they're going to come kicking and screaming along the way. But if you give them options of, here's a 4-month, 6-month, 8-month plan, the odds of them selecting any of those go up dramatically.
Correct.
All right, fifth and final tip, right? Patients really like payment plans. With the rising costs of healthcare, there's so much more money that needs to be collected, and it's falling directly on the patient. They want to be in control, and often that means a payment plan. Very few of your patients can pull out their credit card and swipe it for 10 grand, right? It's not financially viable for many of your patients. But putting out payment plans dramatically increases the likelihood of you getting some money, which
But
means you're not having to write off more and more and more.
they've been conditioned to it. Look at Amazon. You can get on Amazon and buy something in 4 payment plans.
Yeah.
Right? They're doing it more and more and more. So they just get into that rhythm of payment. We've always been there for houses and cars, right? But we're
Mhm.
into that for consumable goods now. So this is the way a lot of people function, is on a payment plan.
Absolutely. We've trained them well and they react really well to it. And again, costs go down for us, right? Win, win, win. Um, okay, last quick slide here. We're going to give you a couple of bonus tips here. We already mentioned options. Patients love options. As a part of that, patients also love discounts. We're seeing some phenomenal success from our client partners when they offer things like pay in full today, because it's a brand new bill, right? So if you pay in the first 30 days, we'll give you a 10% discount. What they're finding is a huge portion of their patients will decide, you know what, I will gladly put this on my credit card and pay it today to get that 10% off. And now they're going, and they may end up still paying just as much money through their credit card and fees and everything else. But the patient's excited about it. They're grateful for the discount, and the institution gets their money. We're also seeing some really great results for patients who are on a payment plan during tax season, offering patients on a plan a 25% discount if they pay it off in full right now. They just got tax returns. They've got a little bit of extra money. By offering them a larger discount, an extra 10, an extra 15, 20% off to get your money today, we're seeing a lot of patients opt into that. And again, you're giving that discount, but holy cow, it makes such a difference, right? If I can get 10 grand today versus 12 grand over the next 12 years, I'll take it today, right? Patients respond really well to discounts. We're also seeing great results in the industry right now around text to pay, but a word of caution here: text to pay in healthcare is a newer channel of payment, and there's a huge spectrum of what text to pay means in healthcare today. Some institutions will say we have text to pay, and what they mean is we'll send you a text to tell you need to pay. Others will have a text to pay where I'll send you a URL, and you can click on that URL and you can go to a website and you can pay. Or it can be we'll send you a text and you can respond to that text, and we'll use your card on file to automatically process the payment and text you back a receipt. You have a huge spectrum of what text to pay means. To Clark's point earlier, right? Patients are on their phone, they're reading their text messages. Text to pay is a really exciting channel that we're seeing some phenomenal engagement on, but know that text to pay could mean a lot of different things. So as you're looking for options, just be aware. It's a new enough channel. Text to pay doesn't mean the same thing to everybody everywhere right now. And then finally, I know we're kind of putting the nail in the coffin here, but your patients are on their phones, right? If you want to engage with patients today, it has to be on a mobile device. It just has to be. That's where they're at. That's how they're engaging. We're seeing 85% and more of our patients either on a cell phone or a tablet of some sort of engagement. It's very few now that are getting onto a large desktop to engage with you digitally or that are coming in person. The vast majority, they're on their phone.
And it's only increasing.
Agreed. Agreed. So Clark, maybe take us home here. If you were to, obviously we've got the screen of here's some takeaways we're thinking of. If you were to wrap this up of where consumers at today and what are you seeing as far as how we need to engage them?
Consumers are embracing technology that makes their life easier. If you're not making the consumer's life easier, you're not going to keep them, because someone else will make them easier. Someone else is going to bring in that surgical center to take away those surgery patients because they can do it better, fast. But it's almost always a digital enhancement that somebody's doing. It's about embracing the digital enhancements, not just sticking your head in the sand and saying this is a hiccup based on COVID stuff and it's going to go away. It's not going to go away. So that's my takeaway is the patient experience is patient experience. We have to turn around and look at it through the eyes of the patient in what they're doing and make it simpler, easier, and a better experience for them to part with their money and do it again and again with the same healthcare provider.
Absolutely. The tricky part is back to the very beginning, right? We know all the reasons why this is hard. We know all the challenges and hurdles we've got to get over to be able to offer these things that we're talking about. The tricky part is how do we get from A to B? Because every institution is extremely unique. You have extremely unique business processes, the EMR that you use, the way that you use it, the technology suites that you've employed across your enterprise. All of those impact both your functional ability to be able to provide experiences as well as the business process limitations, right? Getting from A to B is a really complicated mapping out process. And it's something that we spend a lot of time with our clients and prospective clients of where are you at today? Where do you want to get? And how do you get there? Some of that absolutely, I will say, comes through our platform and our solutions. Not all of it does, right? A lot, and that which is why we're grateful to partner with people like CoreTec, where they're able to help cobble together. You need a solution like Wixcorp for these pieces. You need to bring in these type of tele solutions for voice. You need to be able to pull these different solutions together to create that experience you're looking for. And so for anybody who's kind of scratching your head right now, man, I know my challenges. How do I get to some of these things that Clark and Eric are talking about? We are more than happy to sit down and talk through where you at today, where are you trying to get to, and are there places we can help or not? And if not, where can we, right? Or who can, and how can we help get you from A to B? It's kind of our goal. So if you'd like to look at that, if you'd like some help with any of that, you're welcome to go to the link on the screen at Wixcorp events, schedule a time to chat with us. We'd be happy to kind of walk through that. You're also welcome to contact us directly. I got my information on here and Clark's, but we'd love to help in any way we can.
I want to thank you, Eric, for your time today. It's been very insightful for me, and I'm excited for the opportunity to help more and more healthcare providers deliver, as they are passionate about delivering quality healthcare. We need to be just as passionate about delivering the quality patient experience. And I think with the right tools and resources, we can accomplish that together. But thank you, Eric.
Likewise, and thank you so much for hosting this. We appreciate it. Talk to you soon. Take care, everyone.